Concomitant surgery of anterior vaginal wall prolapse and stress urinary incontinence compared to a two-step approach. Surgical treatment of pelvic organ prolapse and stress urinary incontinence at the same time or the third time is still debated. So the aim of this study was to evaluate the outcome and complication of women underwent concomitant surgery for pelvic organ prolapse and stress urinary incontinence. This is a prospective study assessing named women for vaginal surgery. Allocation of women in Group 1 was based on shared decision during counseling. Group 1 was anterior vaginal wall defect and stress urinary incontinence at the same time, while Group 2 was a control group of only anterior vaginal wall defect, and Group 3 was another control group of only stress urinary incontinence. Surgical procedures were, for Group 1, anterior vaginal wall repair by native tissue technique and middle uterus links, while for Group 2 only anterior vaginal wall repair, and Group 3 only middle uterus links. These are exclusion criteria. Preparative assessment were POP-Q assessment, stress test, and urodynamics for all the patient, and objective success was POP-Q stage equal or inferior than 2, and for stress urinary incontinence, negative stress test. Complications were ranked by Cleveland scale. The study started on January 2014 and concluded on January 2018. We were able to recruit 197 women who completed a follow-up of 2 years and were eligible for the study. As you can see, Group 1 was a little bit with a little bit lower number of patients than Group 2 and Group 3. Follow-up was done by outpatient clinical evaluation at 1, 3, 6, and 12 months, and then every year, with physical examination, urinalysis, abdominal ultrasound, and PVR. Data were analyzed within a 2 years follow-up. As you can see, Group 1 and control groups had similar characteristics. Only one difference is on occult stress urinary incontinence in Group 1 that was present in 16% of women. No other group had this kind of stress urinary incontinence, occult stress urinary incontinence. Results. Mean operative time was higher in concomitant surgery because they did 2 procedures than the others. Hospital stay was longer in Group 1 than Group 2 and then Group 3. There was no significant difference in blood loss, and outcomes were similar in all the groups. There was no significant difference in de novo urgency, and growing pain due to middle uterus links was comparable in Group 1 and 3 because they were all transobturator middle uterus links. Reoperation was low in all the groups. So, as interpretation, we can say that concomitant pelvic organ prolapse and stress urinary incontinence surgical treatment was effective and safe as a single procedure. The association of these 2 surgical treatments did not mean an increase of the complication. Due to the longer operating time in associated surgeries, also blood loss was higher, but with no negative impact on postoperative course and outcomes. Indeed, blood transfusion were performed in women that underwent a single surgical procedure, so they control Group 2. In conclusion, after counseling that identifies the patient who prefer complete resolution of stress urinary incontinence and POP with a single surgical procedure, we consider concomitant surgical treatment of anterior vaginal wall defect and stress urinary incontinence an effective and safe surgical plan. Thank you very much.